Welcome to ADAPT NCLEX. I want to show you how to answer NCLEX case study. And I created this case study. It's very complicated, but it's a content just to show you how certain case study can present in a different way that will make you nervous to see them, but you know the content. Step back, look at it, read it, look for the buzzwords, and then get to it. This is the case study. A lot of information. But if you sit back and try to read and figure out the keywords, which is the buzzwords, you'll be able to know what is wrong with this patient. Like I always say, the first 3 lines should give you a clue and it will lead you to somewhere. 35-year-old male, irrelevant. Present to the emergency room with the complaint of what? Weakness that begins in the leg and has progressively worsened over the past few days. That is the key. Leg and it's worsening. So he started from the leg. He reported feeling fine until about a week ago. This is telling you it was okay when he experienced a mild respiratory infection. That is your key. Leg weakness. 1 week ago, I had respiratory infection before that. This is your diagnosis. You don't need anything anymore. But for completeness sake, we'll go through, but this is how you do. If you're taking the NCLEX, next generation NCLEX, you have to be able to figure out what is wrong with the patient, at least after you read 3 or 4 lines. Since then, he had developed increasing difficulty in walking. So since they've given you the diagnosis, now they're trying to confirm it, giving you more information if you want it. Increasing difficulty of walking, and now he's experiencing weakness in his arm. He started from his leg, now all the way to his hands. He mentioned numbness and tingling sensation in his feet, confirmation, and hands, but deny any pain. There's no pain. He's visibly anxious and stated that he feels as though his muscles are failing him. He's finding it hard to stand because his leg is weak, out from a seated position without assistance. The whole body is paralyzed. And he says his grip strength has weakened. It's just confirmation, giving you more information to confuse you. They report no previous episode of weakness, so this never happened before, and no similar symptoms there. So there's no relapsing and remitting disease, right? He has no significant medical history, takes no medication, and does not smoke, and he drinks occasionally. His temperature, blood pressure, heart rate, everything look fine. His alert oriented ×4. His lung is clear. His heart S1, S2. Abdomen is soft, non-tender, non-distended. Motor exams, something is decreased 3 out of 5 in the lower extremities and 4 out of 5 in the upper extremities. There's no reflexes in his knee. This is just confirmation. There's decrease, basically loss of sensation, hands and feet. Cranial nerve is intact. His coordination is poor and coordination due to weakness. Can you figure out what is wrong with this patient? Can you figure it out? 1 week ago, I had what? Upper respiratory infection. A week later, my leg is weak. Then it progresses to my arm. My whole body is now paralyzed. I can't do anything. What do you think is wrong with this patient? This is not multiple sclerosis. Otherwise, we tell you this happened 6 months ago or 5 months ago. It went away and it came back. This is not great Myasthenia Gravis because what is the problem? There's no weakness that progresses and get worse during the day, and in the evening, it get worse and worse and worse. They have to tell you there's no double vision here. These are all ALS. You see severe weakness is not associated with the respiratory infection, right? So these are the way you'll be able to. So it's not multiple sclerosis. It's not myasthenia gravis, right? This is Guillain Barré syndrome. This is Guillain Barré Syndrome. If you have difficulty trying to figure out, then read the case again and figure out. The client reports recent infection, respiratory infection symptoms before the onset of the weakness. Which of the following is the most likely explanation for this connection that the nurse should know about? Basically, which of these indicate the nurse should know about if you have respiratory infection and you develop this? It's because of post-immune disease, right? It's post-immune. So post-infection, autoimmune infection that may trigger this. The respiratory infection may spread. It doesn't spread. The respiratory infection causes direct infection of the nervous system. No, it's autoimmune and triggering from the infection. Which of the following symptoms the nurse should prioritize on further assessment? The prioritization for this problem is always airway. Their severe weakness is not a problem. Their reflexes that is decreased is not a problem. Their balance problem is not a problem. Airway is always the priority. And then a nurse preparing to initiate the plan of care by the head care. Which of the following the nurse should anticipate in the plan of care? So we got to take care of this patient. What are you going to do? This patient needs to be in the ICU. It may have respiratory failure, so you need oxygen and suction at bed. You don't need tracheostomy right away. You may need a sequential compression to prevent DVT. And you may need to turn the patient back and forth to prevent sacral DQ or soft tissue injury, right? Pressure injury. You don't need SCT. The client respiratory rate is currently within normal. What is the priority nurse intervention for monitoring potential respiratory complication? They're going to have respiratory complication. So how would you know? How do you monitor them? Either you monitor their SATs or you monitor their lung function. Pick an answer choice that relate to the question. Respiratory problem. Monitoring for skin color does not answer question related to respiratory problem. Assessing respiratory rate once per shift is not good. You got to do it multiple times. Frequently measure viral capacity and ability to cough. Ability to cough is to protecting the airway, and viral capacity, how much the lung will open and how much oxygen go into your lung. This is much better. Encourage deep breathing exercise once daily. It's not enough. The healthcare provider plan to initiate pharmacological treatment to the severe disease. Due to severe disease, which prescription the nurse should anticipate, select or apply. What is the treatment for Guillain Barré syndrome? Steroid is autoimmune. Immunomodulator to destroy the antibodies, right? And you can remove their blood and you can wash it to remove the antibodies. That's plasmapheresis. Riluzole is used for ALS, amyotrophic lateral sclerosis, and neostigmine is used for Myasthenia Gravis. Client is anxious about his ability to recover fully. Which response by the nurse is most appropriate? These people will completely recover without any problem, but it will take a long time, sometimes 6 months. Most people with your symptoms experience full recovery over time, although it will take several months. Yes, you will likely continue to experience these symptoms for the rest of your life. It's not true. As long as you follow all treatment instructions, you should recover completely. There's no specific question that you're going to be asked. As long as you follow all treatment, you should recover completely. It takes a while. This is not answer the question completely. Recovery can be challenging, and it is unlikely that you will gain full function. That's not true. So this is the best one. Client is ready for discharge. Which of the following teaching is appropriate? Select or apply. Report any future upper respiratory infection to the air care. Because of your immune response to this infection, every time you have upper respiratory infection, you should let me know, right? Avoid annual vaccine. No, I want you to get vaccination. This has nothing to do with vaccination, right? Ensure all family members are vaccinated against Guillain Barré syndrome. There's no vaccine for that. It's not infectious, okay? You're unlucky to get it and you get into trouble. Monitor skin integrity to prevent injury. Yes, because of the sensation, right? Initiate passive range of motion exercise daily to prevent spastic muscle. Expect to be wheelchair bound for at least 6 months. It's tricky, right? Yes, you may not be walking for 6 months, And so this is very important. So this is the question. It's a GBS question, and he has all the content. Read it carefully. I just use example to show you how they can make the case complicated. But if you know the buzzword, this is a straightforward question. Take care of yourself and have a good day. Bye.